Welcome to the presentation on understanding its impact on bovine calves and human kids. Today we'll delve into the pressing issue of diarrhea caused by rotavirus, particularly focusing on its impact in southern Punjab. This virus affects both livestock and human populations, making it a significant public health and economic concern. Diarrhea is characterized by the frequent passage of loose, watery stools. It's a common symptom of infections like rotavirus, but it can also be caused by bacterial, parasitic infections, food intolerances, medications, and other health conditions. In southern Punjab, diarrhea is prevalent due to limited access to clean water and a poor healthcare system. Rotavirus is a major cause of diarrhea in both humans and animals, including calves, pigs, and other species. The virus is species-specific, meaning the rotavirus that infects calves does not infect humans. It primarily targets the gastrointestinal tract, particularly the small intestine, where it thrives in intensely raised or large production sites. Rotavirus is a non-enveloped virus, which makes it more resistant to environmental degradation. It's an RNA virus with 11 double-stranded segments, allowing for genetic recombination during co-infection, similar to the influenza virus. The virus is made by a 3-layered capsid with VP4 and VP7 proteins on the outer layer, VP6 in the middle, and VP2 on the inner layer. Rotaviruses are subdivided into 9 groups labeled A through I based on the VP6 protein. Groups A, B, and C are most relevant for both humans and bovines, with Group A being the most prevalent and responsible for most disease cases. The VP7 and VP4 proteins are key to protective immunity, making them major targets for vaccine development. Rotavirus spreads through the fecal-oral route, infecting the mature enterocytes in the villi of the small intestine. This infection leads to destruction of these cells, reducing the ability of the intestine to absorb nutrients, leading to what's known as malabsorptive diarrhea. The loss of enterocytes also triggers further dehydration by pulling fluids into the intestinal lumen. In calves, rotavirus infection manifests as severe watery diarrhea that can lead to dehydration, lethargy, weakness, and a loss of appetite. In severe cases, especially where secondary bacterial infections are present, the mortality rate can be as high as 50%. In children, rotavirus infection causes severe diarrhea, vomiting, fever, abdominal pain, and dehydration. These symptoms can become life-threatening if untreated, especially in malnourished children or those with limited access to health care. Globally, rotavirus is responsible for approximately 215,000 deaths annually in children under 5. In southern Punjab, the burden is particularly high due to poverty, limited healthcare access, and low awareness. The virus has a dual impact on livestock and human populations, threatening both economic stability and public health. Rotavirus in calves leads to severe diarrhea, dehydration, and in extreme cases, death. This causes significant financial losses for small-scale farmers due to reduced growth rates, increased veterinary costs, and higher mortality rates. Similarly, in children, rotavirus leads to high mortality risks due to malnutrition and poor healthcare access. Both calves and children suffer from severe diarrhea and dehydration, making them highly susceptible at a young age, particularly in rural southern Punjab. However, while the economic impact is more significant in livestock, health and mortality are more critical issues for human populations. The spread of rotavirus is exacerbated by contaminated water sources and poor sanitation. The hot climate in southern Punjab also worsens dehydration, making the effects of the virus even more severe. For calves, prevention strategies include vaccinating pregnant cows where possible, ensuring clean birthing environments, managing colostrum effectively, and isolating infected calves to prevent the spread of the virus. For children, vaccination campaigns should be prioritized, along with promoting breastfeeding, improving maternal health education, and ensuring access to clean water and sanitation. Educating caregivers about hygiene practices is also crucial, especially when tailored to local customs. While there is no specific treatment for rotavirus in calves, supportive care is essential. This includes fluid and electrolyte therapy, antibiotics for secondary infections, and nutritional support using locally available feeds. For children, treatment involves administering oral rehydration salts, ORS, and promoting homemade rehydration solutions. In severe cases, intravenous fluids may be necessary, often requiring travel to urban centers. Continued feeding with locally available foods is also important for recovery. Challenges in managing rotavirus in livestock include the high cost and limited availability of vaccines, poor farm management practices due to economic constraints, and the lack of veterinary outreach programs. For human populations, the challenges include limited vaccines and healthcare facilities, poor sanitation and hygiene practices, and cultural barriers that limit awareness and preventive measures. In conclusion, rotavirus A presents a significant challenge in southern Punjab. However, with increased community education, improved healthcare access, and better farm management practices, it can be controlled. This requires a coordinated effort to encourage vaccination campaigns, improve sanitation, and support local initiatives that address both livestock and human health. Thank you for your attention. I am now open to any questions or further discussion on the topic.